Good evening, everyone. We are starting with Chapter 15, which is primarily the respiratory system. So, the primary function of the respiratory system is to allow oxygen from the air and blood to enter the blood and carbon dioxide to exit the blood into the air. So you're inspiring, so you're breathing in, conducting air towards the lungs. We do this by expanding the rib cage and creating an area of lower pressure, and then the atmospheric pressure being greater then forces air into the lungs, and then we exhale or expiration by contracting the rib cage or pushing the diaphragm up and compressing the lungs, creating an area of relatively higher pressure than atmospheric, so the air is driven out. Primary functions are to exchange gases, transport the gas from the lungs to the tissue, and then you exchange the gases in the tissue. Just know that the primary function of the nasal cavities is to warm and filter the air, which is why I got these concha here and like things like nasal hairs to warm and humidify the air as you take it down to your lungs, because your alveoli are only a single cell layer thick, so they can be dried out pretty easily. Then you proceed down from the nasal cavity through the pharynx to the trachea, and then the trachea divides into the lungs. The diaphragm here is again the breathing muscle, innervated by C3, 4, and 5. Keep the diaphragm alive. So once you get down into your trachea, it branches off into these bronchioles. Your bronchioles then further subdivide and have all these little alveolar sacs, and each of these again is one cell thick, surrounded by an anastomosis of capillaries. Your red oxygen, your pulmonary artery, which is unique in that it's the only artery carrying deoxygenated blood, brings deoxygenated blood to the alveoli, goes through the anastomosis, and then back out through the pulmonary vein, which is again unique because it's the only vein carrying oxygenated blood. As we talked about, as the air moves in, you clean it with the nose hair and cilia. You warm it because of the heat in your body and moisten it for its passage through the wet surfaces and passages. And then as you exhale, it's cools and loses moisture. Which when it's cold outside, you can see your breath. That fog or vapor that you see is water vapor condensing out of your breath because it's significantly warmer than the surrounding air, and hotter air has a higher capacity to hold water. I would know this table. Don't dwell too much on memorizing every little bit about it, but if you have a general idea of what these things are and what they do, that will be very useful. Nose, upper part of the respiratory tract, includes the nasal passages, or nasal cavities, pharynx, and trachea. Air enters through the nostrils, which are external openings. Sometimes they're referred to as the nares. Contains two nasal cavities, which warm and wash the air. All this we've talked about. Also has odor receptors, which are the olfactory nerves are a branch from the olfactory bulb in your brain. It's actually an extension of your brain into your nose, which is kind of cool. Unless you get an amoeba on it, in which case it can follow that directly into your brain and begin eating it, and you'll get amoebic meningitis. The one around here you have to worry about for that is Naegleria fowleri. It lives in the mud and lakes and such. Your tear glands also drain into the nasal cavity, which is why, like when someone's teary-eyed, they'll often get a runny nose. It's because your lacrimal duct is draining into the nasal cavity, and that's actually tears streaming into your nose. And then you separate this from the mouth by the hard and soft palate. Pharynx is connected to the nasal and oral cavities to the larynx. The nasopharynx is where the nasal cavities open to the posterior soft palate. Oropharynx, where it opens to the mouth. Nasopharyngeals opens to the larynx. The uvula is this little soft extension of the soft palate, project into the oropharynx. And the tonsils form kind of a protective ring against inhaled or swallowed microbes. Basically everything that enters through here gets ran by your tonsils first, and they're, so as you know, they are lymphatic tissue. They've got a lot of cells in there for dealing with and recognizing antigens and invaders, so it kind of gives your immune system a head start. When you swallow, your larynx here actually comes up to the epiglottis and closes this passage, so that way liquids and foods do not enter your trachea. So at its resting rate, it's sitting open. This is why you can't breathe and swallow at the same time. Looking down into the epiglottis here, you have your vocal cords and then your trachea. These are what vibrates in order to produce your voice. Tends to be longer and thicker in males, which compared with a larger nasal cavity and a larger chest will produce a more deeper, more resonating voice. And if they're, tend to be a little thinner and shorter in females, so it's a higher pitch because they vibrate at a shorter frequency. Trachea, or your windpipe. Remember I was telling you before, you have all these cilia and goblet cells. Goblet cells produce mucus. The cilia sweep things out of the lungs towards the pharynx. When you smoke, these cilia are paralyzed or destroyed. And the trachea is held open by these C-shaped cartilaginous rings. You can kind of see them here. When you swallow, the opening of the C is towards the back here, towards the esophagus. So a bolus of food actually pushes into the trachea as you are, or into the esophagus from the trachea as you swallow. Trachea is divided into the right and left primary bronchi, and then those separate into secondary bronchi, eventually down to the bronchioles, and that's where the like alveoli actually are. Every time you divide, you get thinner. Divide and subdivide, then the walls get thinner, and then eventually it's thin enough that you don't have the cartilage rings anymore, and it's just this little single cell wall of alveoli. The lungs are paired cone-shaped organs, occupy the thoracic cavity, which is separated from the abdominal cavity by the diaphragm. The right lung has 3 lobes, the left lung has 2, which allows room for the heart. And then those are each subdivided into lobules, which is why if you get lung cancer, they can usually just cut out one lobule and then you're fine, instead of having to remove the entire lung. Each lung is covered by serous membranes called pleura, and then you have another one covering the internal chest cavity and the diaphragm, or internal wall of the chest cavity and the diaphragm. And they produce a lubricating serous fluid that allows them to slide freely against each other, so that way you don't have friction or chafing every time you breathe. And basically, surface tension is what keeps the lungs like glued to the walls of the rib cage. Alveoli are made of simple squamous epithelial surrounded by blood capillaries, which is where your gas diffusion takes place. Oxygen diffuses across the walls into the blood, and CO2 diffuses into the alveoli. The reason that occurs in that particular direction is because there's a higher concentration of oxygen in the air than there is in the red blood cells at this point, and a higher concentration of CO2 in the red blood cells than there is in the air. So everything goes from high concentration to low. That way we don't have to actively expend energy to pump CO2 and oxygen, which saves us a lot of trouble. If you're born too early, then you have a lack of surfactant, which is one of the reasons why if a pregnancy is before a certain number of weeks, they'll try to give them steroids to help bolster lung development, or to open the lungs anyway, and magnesium to prevent contractions. Try to buy during that phase, every day is gold in terms of the survival of the newborn. During ventilation, free airflow is important. And you can use a device called a spirometer to record the volume of air that is exchanged. So spirometer records the volume during both normal and deep breathing, and the spirogram is a record of the measurements. So it will end up looking something like this. So your average inspiration would be something like this, maximum inspiration, maximum expiration. So you can see it's considerably more, but there's always a small amount of gas that is never really exchanged in any given breath. Now, I mean, obviously, because air is constantly mixed within itself, it's not like there's one little bit here of gas that just kind of forms a cloud or something at the bottom that never gets exchanged. This mixes with the new air coming in and out. It's just that there's this much volume that you can't forcibly exhale. So tidal volume is your resting volume, normally about 500 milliliters. Then the vital capacity is the volume moved in and out in each breath. There's various illnesses like pneumonia can impact your vital capacity. For instance, if you have the severe pneumonia and your lungs are filling with fluid, then you have considerably less volume to exchange gases with. Your internal reserve volume is forced air inhalation moved in addition to the tidal volume. So basically just as much as you can forcibly inhale. So you can usually get about 3 liters above tidal volume. And then expiratory reserve volume is how much you can forcefully exhale, which is usually about 1.5 liters. And together those are your vital capacity. And then all of these depend on age, gender, physical conditioning, height, whether or not you smoke. People who chronically smoke, they tend to inhale more in an effort to try to get a greater exchange because their lungs are not functioning as well. And over time, they will develop a barrel chest where their chest is fully expanded at all times, and they basically breathe with their stomach by or using their diaphragm, and it looks like they're belly breathing, basically. So normal respiratory volume, only about 70% of the tidal volume reaches the alveoli, 30% remains in the airways. And even after a deep exhalation, you will still have air in the lungs. You can still feel it there. Even after exhaling as much as possible, I can still talk, which you have to be exhaling in order to speak. Or there has to be air moving through your vocal cords in order to speak, is what I should say. So this residual volume is about 1,000 milliliters of air. There's a continuous column of air from the pharynx to the alveoli, and the lungs lie in the sealed off thoracic cavity. Rib cage forms the top and sides. Intercostal muscles lie between the ribs, and the diaphragm is the floor. And then the lungs adhere to the thoracic wall by means of the pleura. So, inspiration, the diaphragm will contract, so it's moving down. It gets because it's sitting in kind of a dome, so you pull it taut, and it will move down. And then your ribs move up and out, so this increases the volume of your rib cage, and that creates the negative pressure. Air comes rushing in. For expirations, you do the exact opposite. Relax the diaphragm and it will go back up, and the ribs come down. And in decreases the volume of the rib cage, increases the pressure, air rushes out. This is also why when people are out of breath, you'll see them brace themselves on their arms. So they're actually providing an anchor point for the secondary muscles of respiration to pull off of, so that it helps them to expand their ribs more. Generally, adults have a resting rate of 12 to 20 ventilations per minute. Respiratory centers are located in the medulla oblongata and controls ventilation rhythm. by sending signals to to particular muscles, so like your intercostal muscles and diaphragm and other muscles of respiration. When the center stops, then signals are not sent to the muscles. We do have a limited amount of manual control over breathing as well, but eventually you will breathe if you try to hold your breath. Even if you're, say, underwater, you will eventually inhale, which is how your lungs fill with water and you drown. Also, fun fact, if a kid ever threatens to hold their breath until they turn purple, it's an empty threat, because even if they do have the willpower to do so, eventually they will pass out and start breathing. So, do with that information what you will. Expiration begins when the respiratory center ceases sending out nerve impulses, and the diaphragm and external intercostals then relax, and it's also your respiratory center is also influenced by chemical and neural input. So depending on your hormones and your state, it will affect your respiration rate. So the main chemical inputs here we have CO2 and hydrogen levels. So CO2 is your primary driving force. You will die of carbon dioxide poisoning long before you die from a lack of oxygen. So this makes sense to be the primary driver. And your hydrogen concentration is how you control the pH in your blood. So, and again, we exist within a very narrow band of pH, so that makes good sense that you have to keep that controlled. And it's indirectly responsive to oxygen, which again makes good sense. You have to have oxygen to survive. So when you do not have enough oxygen, then you will increase your respiratory rate to try to breathe more. Too much oxygen can actually depress your respiratory drive, which is why if you are ever put on oxygen, you should leave it on whatever dose your physician recommends and not add additional oxygen, because you will be decreasing your respiratory drive and you'll actually be getting less into circulation. We already talked about this bit. Just know that the heme portion of hemoglobin contains iron, and the whole thing is it's this portoporphyrin ring thing. And the whole point of it is iron is insanely toxic to cells, and so we have to contain it in a little cage where we can use it, because it's if you ever left iron outside, you know how quickly it rusts. That rusting is an oxidative process, oxygen binding to it, which is what we use it for here. So in a way, you have rust in your blood, at least when the hemoglobin is oxygenated. And that's how we transport the oxygen around. Gas exchanges in the alveoli. Partial pressure refers to the amount of the pressure of each gas in a mixture that it exerts. So the P, the partial pressure of CO2 and O2. Basically what that means is like when you have gas in a container, there is pressure being exerted on the walls of that container. And so you have the total amount of pressure, and then if you were to say, okay, well, how much pressure is being exerted by the CO2 in that container versus, say, the nitrogen or whatever, then that will tell you how much is there, relatively speaking. External respiration, so most CO2 is carried as bicarb. And then carbonic anhydrase catalyzes the breakdown of carbonic acid into bicarb here. So this is how we transport CO2 in the blood. Blood's capacity to diffuse CO2 gas is actually fairly low, but you can stick a ton of carbonic acid or bicarb in your blood. And if you'll notice, we have a acid and a base, and CO2 here can be removed from it. So this is one of the mechanisms by which you can control the pH of your blood. You blow off more CO2, you drive down your bicarb I'm sorry, you drive down the carbonic acid, which is why, like, when you're in keto diabetic acidosis, which is a metabolic acidosis, you hyperventilate to try to blow off more of your more acid to drive your pH back down. And what you're getting rid of the carbon dioxide in that process. Pressure gradient for oxygen is the reverse of carbon dioxide. So if you have low partial pressure of oxygen in the capillaries, it'll be high in the alveoli. Then your oxygen will diffuse into the blood. Hemoglobin picks it up and becomes oxyhemoglobin. And then for your internal respiration, you have a lot of oxygen on your oxyhemoglobin, high partial pressure of CO2 in your capillaries, and relatively low in the tissues, so the oxygen will leave hemoglobin and diffuse from the blood into the tissues. And you do the opposite with CO2. Y'all may have heard of carbon monoxide poisoning, which is CO, carbon and one oxygen, carbon monoxide. It binds more tightly to hemoglobin than oxygen or CO2 does. So if you breathe in enough carbon monoxide, you're essentially preventing this from happening. You're binding up all of your hemoglobin. It takes about 20% saturation to be lethal. If you smoke, you're already somewhere between 5 and 10%. Feel free to pause and look over this if you need a more pictorial explanation of where things go and how they are exchanged, but this is basically everything that we just said summed up in one picture. The respiratory tract is constantly exposed to the outside air, meaning it's very susceptible to infectious agents, pollution, tobacco smoke. Upper respiratory tract includes the nasal cavities, pharynx, and larynx, and is susceptible to a variety of viral bacterial infections due to the filtering production. Upper respiratory infections can also spread to the middle ear or the sinuses. The common cold is usually caused by rhinoviruses. Generally speaking, a coronavirus causes symptoms similar to the common cold, though the current strain we have running around right now, COVID-19, is a little worse. Usually lasts for a few days to a week if you have a healthy immune system. Antibiotics are ineffective because it's a virus, and basically you just treat the symptoms. Pharyngitis is inflammation of the throat due to infections. The strep pyogenes causes strep throat. Streptococcus pyogenes. Strep pyogenes causes a lot of bad things, including necrotizing fasciitis and rheumatic fever. So if you only get strep throat from it, it's not that bad. Once you've got an infection like this, though, because it's a bacterial infection, you can treat it with antibiotics. Tonsillitis, which is what you're looking at right here. This is really inflamed tonsils. Become inflamed and enlarged. If you get it all the time, sometimes they will surgically remove them when they the suffix ectomy. If I can get it to only. It's not going to cooperate with me. There we go. This means removal of. So anytime you see this suffix, so tonsillectomy, the removal of the tonsils. The conventional wisdom is always, if you get frequent tonsil infections, cut them out. But if I'm remembering correctly, the current medical advice is to leave them and just treat the infections, because they're catching the problem here instead of it getting somewhere else in your system that could be worse. Laryngitis, inflammation of the larynx. Itis, that suffix, means inflammation. So laryngitis, inflammation of the larynx. Hoarseness, difficulty speaking. Sometimes you can get polyps that develop on the vocal cords, especially for individuals that use them excessively. Think like opera or uh, death metal singers. You know, people that are just like constantly putting their vocal cords through the ringer. Um, Sinusitis, inflammation of the sinuses within the facial skeleton, drains into the nasal cavities. Usually, when you have a blocked opening, you can get postnasal discharge, headache, facial pain. About 10% of upper respiratory infections are also accompanied by sinusitis. Not a lot you can do with it. You know, take some anti-inflammatories, get your head cleared out. You know, hot showers, that sort of thing. If it gets completely blocked up and a infection sets up inside some of your sinuses, and sometimes they have to go in and like surgically drain them. Otitis media, inflammation of the middle ear. Often a infection spread to the ear by way of the eustachian tubes. And so in this case here, they put a tube in the tympanic membrane so that the middle ear can drain to prevent those infections. Generally only done in children because adults have significantly larger eustachian tubes, so this isn't really necessary. And these will usually fall out on their own after a week or two, or I'm sorry, after like a month or so, and then the tympanic membrane will heal up. Disorders of the lower respiratory tract. So main things you want to worry about with this are things that get lodged in the trachea, excessive mucus in the bronchi or bronchioles, and then conditions that restrict normal elasticity. So choking, you get something in the trachea, so that's what the Heimlich maneuver is for. You take your right arm and you make a fist, you put your thumb on their, or the knuckle of your thumb from the fist on their solar plexus or just below. You take your left arm, grab your fist, and then you pull up about as hard, like up and towards your center, or towards the back of your shoulders, like a 45-degree angle, about as hard as you can. And the idea is you're trying to forcibly compress the lungs to create enough pressure to expel the blocked or the foreign object that is blocking the trachea. Or you can do a tracheotomy, which is the insertion of a breathing tube into the trachea, which again, if you remember, it has those cartilaginous C-shaped rings, and if you kind of tilt your head back, you can feel those rings in your trachea. So for a tracheotomy, you would find those rings, make an incision in between them, and then stick a tube in there. And that's useful for, like, if you can't get the obstruction out. Some people end up, if they have their trachea destroyed, or say it was removed because of cancer or something along those lines, then they have a permanent tracheotomy to allow breathing. Acute bronchitis, which no one here has time for. Inflammation of the primary and secondary bronchi, usually preceded by a viral infection that leads to a secondary bacterial infection. I've had this more than a few times. It's never fun. Chronic bronchitis, airways are inflamed and filled with mucus. Bronchi undergo a degenerative change, including loss of cilia, generally caused by smoking. Asthma, a disease of bronchioles and bronchi, marked by wheezing, breathlessness, sometimes coughing, and expiration of mucus. Usually triggered by specific irritants and causes the smooth muscles in the bronchioles to spasm. Can't really do anything about it but treat the symptoms. Though they have discovered that if you, like when you were a child, if you get outside and you're exposed to like dust and dirt, and particularly like on a farm or something, you're something like 38% less likely to develop asthma later in life. And if you live in a house with a germaphobe and you never get exposed to anything, you're like 11% more likely to develop asthma. So there's some theory that it's basically that these specific irritants, because your immune system never really got a chance to practice dealing with things, then it sees these irritants and kind of flips out because it doesn't know what will kill you and what is a mild irritant. And so it just gives everything it sees both barrels, and that causes problems. Pneumonia, an inflammation of the bronchi or alveoli filled with thick fluid, includes high fever, chest pain, headaches caused by bacterial, viruses, fungus, what have you. Pulmonary tuberculosis caused by Mycobacterium tuberculosis, so named because they form this protective capsule called a tubercle around the invading bacteria, so it's pretty hard to get rid of once it's in there. And if your resistance to it is low, the bacteria will then escape and spread. TB skin test is the standard method for checking for tuberculosis. And then they'll follow that up with an X-ray if it's positive. Emphysema is a chronic incurable disease. Damages the wall of the alveoli, reducing their surface area for gas exchange. And then COPD is usually a chronic obstructive pulmonary disease, usually associated with smoking. Both this and COPD. Basically, over time, when people say, "Well, I got like half a lung," if they've been smoking for 30 years, they're probably not wrong. You'll eventually have large areas where there are no alveoli anymore, and it's just like a bubble, and that bubble is almost completely useless for gas exchange. Cystic fibrosis, a recessive genetic condition caused by a defective protein for calcium transport. Mucus in the lungs becomes very thick and sticky, which interferes with breathing. Pulmonary fibrosis, the fibrous connective tissue that builds up in the lungs, causing a lack of elasticity, reduces your vital capacity. This is the problem here with bronchitis. You get all this extra mucus constricting the airways. So the people, like when they have bronchitis, they'll often get up in the morning and cough and hack and clear, a bunch of mucus or pus out of their lungs in order to be able to breathe properly for the rest of the day. Asthma, on the other hand, you have this irritation from some irritant, and the bronchioles constrict due to muscle spasms, and that constriction causes a significant narrowing of your airways. Pneumonia, you've got fluid and pus in your alveoli, reducing your surface area, making gas exchange difficult. Tuberculosis forms little tubercles. Emphysema, so you can see all these little subdivisions and whatnot here, but this is hollowed out in emphysema, and over time you'll just lose this whole thing altogether. And then asbestos. I read that wrong. So then in pulmonary fibrosis, you have all this fibrous connective tissue building up in the lungs, and that kind of prevents them from stretching and expanding. Diseases of the lungs, so lung cancer, leading cause of cancer death in men and women. Most cases are associated with cigarette smoke. So you progressively have thinning of the cells lining the bronchi, loss of cilia, appearance of cells with atypical nucleus that you form a tumor, and then that metastasizes and spreads to the rest of the body. So normal lung, cancerous lung. And all of this, so the tumor's right here. All this black, tarry looking goo, that's from cigarette smoke. Like cigarettes alone will do that to you. Unless, like, the only other way you're going to get lungs like this is if you're a coal miner or something. And then the tumor right here is just destroying the rest of the tissue around it. So that is it for chapter 15. If you have any questions, comments, concerns, feel free to contact me, and good luck.